Live from WAVE in Louisville, Kentucky. This is Listens Live.
Welcome into WAVE Listens Live. I'm Michael Vanover. We are on location at Mays Plastic Surgery and the spa at MPS. Joining me now is Dr. Chet Mays, board-certified plastic surgeon. Dr. Mays, thanks for having us back. It's so beautiful out here.
Yeah, it's always a pleasure when you guys come out and see the facility because we love showing this place off. So anytime you come here and can actually show our beautiful facility at the spa at MPS and Mays Plastic Surgery, we're happy to have you. You're always welcome.
Well, thank you. Thank you. One of the things you always talk about, and we'll get into service lines and the things that you guys offer, but you talk about wanting to make it an experience out here. Talk about what that experience is like and what went into, I guess, this as your brainchild.
Yeah, so as a plastic surgeon, attention to detail is everything that we do, and it's not just on the surgical side. It's the moment you walk in the doors. So we design this place. When you walk in the front doors, when you open those doors, I want people to just look and know they're somewhere different. Even though we're in St. Matthews here in Louisville, Kentucky, there's a lot going on around us. I want them when they come in to have that experience from what you see, what you smell, even the smells we infuse here into the practice. It should elicit some type of response from you. So from the moment you come in and get greeted by one of our patient coordinators to wherever you're going in the office, whether it's down in the clinic with me or up here in the beautiful med spa, I want you to have that great experience and know where you're at and you're having something special that day.
Yeah, and you feel it and you smell it, as you said, which I love. Talk a little bit about all of the service lines that you offer, because you all do a lot here.
Yeah, so Mays Plastic Surgery, obviously I'm Dr. Mays, that's where it sort of started, build everything around plastic surgery. And the spa component, there's a lot of med spas in town, right? You go every corner, here there's a med spa. One of the things that separates us apart is it's overseen by board certified plastic surgeons. So all the treatments that we're doing are overseen by myself and some of our medical experts here. So that's a very unique thing about the spa at MPS is the oversight from the board certified plastic surgeon. But we have something for everyone, right? Not everyone's a plastic surgery candidate. I don't think it's for everybody. And that's where the spa at MPS comes in. It comes in for maybe you just need a facial or you want to get your skin ready for that event coming up. I know it's springtime now, Derby's in the air. We're going to talk a little bit about that today, but there's something from everybody, from where there's no downtime, you come in, just get a little glow, to something that might take you out for a few days to really get an extra glow or some shine to the skin that you really want to achieve. But it really starts out with that consultation, coming in, talking to one of our providers, whether it's the estheticians, the nurse injectors, or myself. We have something for everyone based on what your goals are for that day.
I think it's important, Dr. Mays, you talk about how there is something for everyone. If people are watching right now, it doesn't mean that, you necessarily have to have surgery. There are so many different levels, and people, giving people the confidence back that they want when you're able to have them walking out of here feeling a certain way. Your passion is pretty contagious, but can you talk about, how that makes you feel, and your team for that matter?
Yeah, so, we all look at ourselves every day, whether we're going to work or going to school or taking care of the kids or whatever we're doing. We look in the mirror and we have this image in our head of what we look like, or you see a picture, and when you look in the mirror, you're like, I don't think I look like that. And one of the things that we can do here is try and get you closer to the way you feel on the inside to what you see on the outside. And it's not always surgical, right? There's things that we do that don't require the knife or going to the operating room. There's little changes we can make, but it's really believing in the team here, right? If you just come in and think it's going to be one quick thing, you're done and you're good for the next 10 years. No, it's really believing in your provider, trusting their recommendations on skincare, trusting their recommendations on the non-surgicals. And then if you want to take the next step into the surgical side, you come see me and talk about your goals of what you want to achieve.
As I said earlier, your passion is very clear. What would you say your why is? And I'm sure this is tied into kind of how you are different from other places around town.
Yeah, it's sort of what we talked about before, right? People have this image of themselves, and sometimes plastic surgeons get a bad rap. If you watch TV or a show, you think they're coming in with a marker and marking all your imperfections, and that's not my approach. My approach is to sit and to listen to someone. What are their concerns? What are you seeing that's bothering you? Okay, that bothers you. It's not bothering me, but I need to come up with a plan for you that's going to achieve your goals. Not everyone has the same goals. It's not a cookie cutter approach. So me as a plastic surgeon, I want to sit, I want to listen to my clients, and if they're not a surgical patient, I want to make sure I get them up to the spa at MPS with one of our expert providers who can walk them down that pathway, and they have that same philosophy, just sitting and listen. But the patient also has to be receptive to our recommendations, right? We see a lot of information on social media. You might read about something in a magazine, you come in and ask about that, and you realize you're probably not the best candidate for that, so you have to trust your provider that they're going to take you down the pathway that's the best for you.
You know, and I think we touched on how, you know, you guys are different from other places in town. One of the things that, you know, and I've even talked to your patients before, and then they talk about, you know, your bedside manner and the way you listen and the way you know, because like you said, something that might bother them doesn't bother you, but hey, you want to make them feel good. And talk a little bit about how important that is to listen and really, you know, leave your patients, you know, going around town singing your praises, I guess.
Well, thank you for the compliment.
Absolutely.
But it's really just listening, because, like I said, I don't look at people and find imperfections. Like, you would go crazy if you're always looking for, because there is no actual perfect out there. It's right. What is your version of perfect?
Right.
Like, what is perfect to you? What do you think's perfect?
Right.
Okay, this is what you think's perfect. Well, this is the expectation I have for where you want to go. So it's really having a back and forth with the clients, making sure that I'm achieving their expectations. Because if there is, you know, someone who's unhappy with about something, it's about our expectations didn't align. And we do say no a lot here. There are sometimes clients come in and they show you a picture of something they want, and you'll never get them to that. And you got to be able to say no at times and to guide them down that pathway.
All right. Well, we've got a lot more to get to with Dr. Mays out here at Mays Plastic Surgery and the Spa at MPS when we're back on Wave Listen. Stay with us.